Let's begin. Hello and welcome to today's episode of Game of Nutrition podcast, where we dive deep into the world of health, wellness, and everything in between. I'm your host Khadija. I'm a certified holistic coach and a consulting nutritionist. In today's conversation is going to be a lot about what you are interested in, PCOS. But it's not just about diagnosis. We're going to talk about something that hits closer to home. How women with PCOS can balance managing their health and maintaining an active social life without feeling left out or overwhelmed by FOMO, which is the fear of missing out. So I'm thrilled to introduce our guest today, Dr. Nimarjeet Kaur. She's a seasoned Ayurvedic physician and a passionate mindfulness coach. She's dedicated to helping women navigate challenges of PCOS and many more conditions. She has over 17 years of experience, as well as she combines her knowledge of Ayurveda as well as deep understanding of emotional wellness. You're welcome to Game of Nutrition. We're excited to have you here. Before we dive into what the topic is about, I would like you to introduce yourself and as in why you chose this field and how have you come to, 17 years been in this field, and let's hear it from you.
Thank you so much, Khadija, for having me here. I am an Ayurvedic physician. I'm MD Ayurveda. My post graduation is in Ayurveda and Manochikitsa. And how I chose Ayurveda. So, actually, I always wanted to be a teacher, very honestly. But my father wanted me to be a doctor. And so I chose this field. I cleared my exams and I became an Ayurvedic doctor. And after Ayurveda, I always wanted, because I always wanted to be a teacher. So I thought, why not start imparting knowledge of Ayurveda to people? This is how I can even fulfill my passion. So that's how I came into the field of Ayurveda and creating awareness about Ayurveda. And yes, Ayurveda is something that I love. Although when I joined studying Ayurveda, it was not something I was very curious about. But after diving deep into the ancient science, really started enjoying this science. Plus, when I went to the post graduation part, where my post graduation was in the basics of Ayurveda and the advanced Ayurvedic techniques, along with Manochikitsa. From there, I started getting interested in mindfulness as well. So now, whenever I treat my patients, I always combine Ayurveda with Manochikitsa. That's how we are talking about today, about the topic of fear of missing out in PCOS. And yeah, that's it. So we can,
So,
yeah.
a quick question for you. If you had to pick up one herb or herbal remedy that's been a game changer for you, what would you choose?
I will choose aloe vera juice and aloe vera. I can say herb, which is aloe vera, because aloe vera has so many proven miracles. People say that it is very good for hair, it is very good for your skin. But personally, I've been using it for myself and for my patients in regulating their cycles in PCOS. It's an amazing herb that actually acts as a uterine tonic as well. So when we talk about Ayurvedic medicines to regulate cycles, mostly because it is a Vataj dosh, right? Vat is very much vitiated in PCOS. So whenever I want to calm down Vat dosh, I have to give something which is hot in nature, so that women who is not having like regular cycles can start having regular cycles. But aloe vera is one herb which is not even hot in nature and can still regulate cycles without even the help of external medications or hormones. So, aloe vera, yes, it has been always my favorite herb when it comes to PCOS or overall well being as well.
So, can you explain Vath to the audience in simple lay language, just in a one sentence?
Okay, so Vat is Vayu. Vayu means air. So we have three doshas: Vat, Pitta, Kapha. Vat corresponds to air, and Pitta corresponds to fire, and Kapha corresponds to mucus in our body. So anybody who is having more of air, Vat dosha in their body will be Vataj body composition. And I by Vataj I mean emotionally they'll be very restless and anxious people by nature, like right from the childhood. And Pittaj people, they will be very aggressive in doing things, very much like they will be short tempered. And Kapha people, very calm people, but very dull at the same time. So any of this dosha, if it increases in the body, it disturbs the functions of the body. If it reduces in the body, it again disturbs the function in the body. So to actually perform perfectly, it is very important to have all three doshas in balance.
Okay, let's talk about how PCOS and insulin resistance is related. And I've heard about cinnamon being used as a regulator for, and it can be added into a lot of recipes. And what's your view on that?
See, PCOS, because it is when PCOS happens, your hormone starts going, out of balance. Insulin is a very, very important hormone. And if we talk about PCOS, PCOS is actually driven by two main hormones. Of course, there are progesterone, estrogen, which all we have heard, but two key hormones that we need to regulate PCOS, to reverse PCOS. One is insulin, and the other is cortisol. Okay, and that's what we are going to talk about today, because cortisol is corresponds to stress, and PCOS, insulin corresponds to PCOS. So whenever the cells, they become resistant to insulin, they stop absorbing sugar, we call that condition as insulin resistance. So what happens as a result is that sugar starts floating in the blood. So that's how the PCOS patients have the tendency towards getting diabetic in the later stages of their life, if they don't take care of their sugar levels whenever they are diagnosed with PCOS.
Yeah, that's true. And we have seen a lot of cases also that they do get diabetes later in life, and it's
And
important
they
to
are
control.
diabetic right from the point they have diagnosed with PCOS. So if you get HbA1c done, these people will have more of insulin and more of sugar as well. Now, how this happens? Because when the for example, I'll tell you how it starts. Actually, when there is a fat deposition around the cells, okay, so insulin is not able to function properly. It is not able to insert sugar in the cells. So when the
Yeah.
sugar does not get inserted in the cells, pancreas gets the signal that maybe insulin less. So they start producing more insulin. So when insulin is produced in larger quantities, okay, so when you test the blood insulin levels of the blood in PCOS patient, insulin levels will be more. At the same time, sugar levels will also be more. So there is not a problem in the production of insulin in this kind of diabetes. That's why they end up having type 2 diabetes. There is a problem in insulin absorption. And what cinnamon does, that you just asked me and I missed that. What cinnamon does is cinnamon helps in burning the fat around the cells. That's how it improves our insulin resistance. It improves insulin sensitivity of the cells towards insulin.
Yeah. I think it's very clear with the audience what exactly cinnamon does, as well as aloe vera. But before we get into PCOS, there's a lot of confusion regarding PCOS as well as PCOD. So what is the key difference, if you can state that?
See, key differences in the full form of both of them. So PCOS is polycystic ovarian syndrome. PCOD is polycystic ovarian disease. Now, first I'll tell you what is it according to science. Then I'll tell you what is it according to me. Okay. And according to science, any disease, any PCO condition which is limited to the ovaries and the symptoms of ovaries. Suppose there are cysts in the ovaries and the cycles are irregular. That's it. It is PCOD. When the disease does not stay confined only till the reproductive part, but the symptoms start spreading overall in the body, like having more of belly fat in the lower belly, having acne, right? Having weight fluctuations, having hirsutism, having hair fall, all these things, when it converts into a set of diseases, it is called syndrome. But if you ask me, I will say that PCOS is just like another condition of ovaries. Like pregnancy is a condition of uterus, PCO is a condition of ovaries. What we do when we are pregnant, we take extra care of our body. What we have to do if we want to reverse PCO? we have to take extra care of our body. So if we take PCOS this way, I think nobody will suffer from FOMO, which we are going to talk about today.
Well, that's an interesting way to look at it. Look at the condition, and it's more like a pregnant ovaries kind of a situation. So, is PCOS reversible? What's your view on that?
Definitely. I have been a PCOS patient. I will say that I'm still a PCOS person, but I have reversed the symptoms. So, for this, we have to understand that what is the difference between reversal and cure. For example, somebody catches dengue. Okay, it's diagnosed with dengue. We treat dengue symptoms and we treat the causes, and it is cured. Now, that person is not going to stay a dengue patient whole of their life. Okay, neither there are chances of relapse of it unless same kind of mosquito bite that person again. But in case of reversible diseases which are not curable, the only difference is that we can reverse PCOS at any stage with our proper lifestyle. But the moment our lifestyle go haywire, for example, stress is more, for example, I'm not able to exercise regularly or follow the diet, or maybe, I'm just overthinking about a certain particular topic, or there is more work stress, then I am going to start getting the symptoms. It happens with me even after reversing this after 16, 15 years. I got my PCOS attack after I delivered my baby. So my son is now 15 years. So sometimes, when there is more stress and I'm not able to take care of my body, at that time, I sometimes, the flow becomes scanty. Sometimes the periods are 4 days delayed. So I start understanding, okay, now it had started getting flared up, so I start taking care of myself more, and then again I reverse it. So difference is I might not get the symptoms maybe for another 10 years, like for more than 10 years I was not having any symptoms. But as my body is aging, I'm 42 now, so as my body is aging, definitely whenever I am careless towards my body, towards self care, I am going to show up those symptoms. So yes, PCOS is 200% reversible, but it is not curable. You will have to take care of yourself whole life. It's kind of lifelong commitment with your body.
That's how we need to understand the importance of self-care when it comes to. I think it's there because a lot of women these days are, selfless and they don't care about their body and their health, and they think about only the family. So that's when I think this ovary pregnancy is the problem which is helping us maybe to somewhere take care of ourselves and show us how to move ahead. But before we get into the game, there is a simple what, who, and why does PCOS happen. So you have explained what is PCOS. Let's not get into that again. But why does it happen, and who does it affect?
Okay, first I'll take the last question. Who does it affect? If you study online, if you take the information that is according to the survey, you will see that between 8 to 21% of women suffer from PCOS in their lifetime. Okay. But if you ask me, I would say every woman has PCOS once in their lifetime. Okay. And because, see, now the thing is that we cannot take care of ourselves, like, and we have been programmed to take care of our family before us. But if I talk about my mother, was she ever diagnosed with PCOS? Never. But she might have got PCOS, which didn't surface because of her lifestyle. Because our ancestors had such an amazing lifestyle. They used to walk a lot. They used to use, like, our lifestyle has become a lot sedentary relative to our parents. So that's why it never ever occurred there. It was never diagnosed over there. People were not getting their ultrasounds done, so they don't know whether they have cyst in the ovaries or not. So if I talk about my mother-in-law, she is the most, active lady I know in her age. But when we got her ultrasound done during her menopause age, we came to know that the cysts were already there. But she was getting regular periods because she was very active. She's still very active. There are fibroids as well, which are not affecting her, which are silent just because she has very active lifestyle. So according to me and my experience, when anybody comes to my because I also run clinical research projects about PCOS and diabetes. So when I was in a project, in one of the project, in one of the clinical study, so any women of PCOS who used to enroll with us, I always used to get one sonography done for her mother, for her masi, like mother sister, and for siblings. And there were relatives who had PCOS, but they didn't have any symptoms. Okay, I would say they had polycystic ovaries. I will now, PCOS is not just polycystic ovaries, but they had polycystic ovaries, but it never, it never progressed to having those symptoms because they had a very good lifestyle. Okay, so between 8 to 21% of women globally, they have a PCOS if we talk about surveys.
Okay, and I think that covers the part on why does PCOS happen as well, because there is
Yes.
a factor that plays in heredity as well as lifestyle,
Hmm.
and who is definitely, I think, all the women, as you say. And let's get into the game. So the game is simple as usual. We have 5 questions on true or false, and 5 questions are MCQ. So the game will be the questions will be shown on your screen, and I think that if the audience is ready, we'll begin. And there's a little lag when we show the questions and when the audience gets to see the questions. So we'll just get back to the answers from the audience after our discussion on the answers of the questions. So the first question is PCOS only affects women who are overweight. I'm sure we have had enough discussion and the answers are what we have already discussed about. So let's wait for the audience to give the answers. You can just type in T and F to make it quicker, audience. So there are answers that are coming in. False, no. I think so. So can you explain in short how PCOS affects women who are oddly overweight?
So I won't say that it only affects women who are overweight. So there are women who are, there is a special, like very undiscussed kind of PCOS, which is called lean PCOS. So lean PCOS patients are usually Pitta Prakriti. They have a lot of aggression in themselves. They have a lot of heat in themselves. And they also have stress cortisol. Now, I'll tell you the difference between overweight PCOS and lean PCOS. Like, overweight PCOS will have more insulin resistance than more cortisol levels. The lean PCOS will have more cortisol levels than more insulin levels. So that's the difference. So this is false. PCOS also affects lean women.
Yeah, and as well as that, when it comes to science, I think dietary intervention is important when it comes to, this kind of a situation wherein overweight is a reason for PCOS. So having the glycemic load in line with the food as well as the Ayurvedic approaches that you can highlight on.
Yeah, because see, when we say insulin resistance, we discuss that it happens because of the accumulation of fat around the cell, right? So definitely overweight women will have more fat percentage. So they are prone to PCOS. Definitely they have the tendency towards PCOS and because of that fat. So, but at the same time, even women who have high cortisol levels, even though they don't have any kind of fat percentage around their organs, they also have a tendency of developing lean PCOS. But if we talk about between obese and lean women, obese women has more tendency.
Yeah. Okay. The second question, a woman with PCOS cannot conceive, and the audience has put in correctly false. And
Okay.
many women with PCOS have conceived. We have multiple, examples right in front of us, and I think a lot of women are educated and they know around them. They have examples. They have faced challenges. There's problem with irregular ovulation, but with proper management and treatment, that can be brought back to proper, in sync with the cycle. And definitely omega-3 rich foods as well as antioxidants are important when it comes to managing the cycles and ovulation.
And also, one thing is that this is actually their mind is being programmed when they are diagnosed with PCOS before, before marriage. Okay, most of the women they come to know that they are PCOS when they are trying for pregnancy. Okay, so at that time their mind is being programmed that it will be difficult to get pregnant, and that's our mind always, our emotions and thoughts gravitate in our body functions as per our mind instructions. So
Yeah.
when we are instructing mind with an instruction that women with PCOS cannot conceive, we are going to believe this. So I think that's more of a belief. I came to know that I am a PCOS patient. Like, I was diagnosed with aggressive PCOS when I actually delivered after the delivery. So I conceived normally, I delivered normally.
Yeah. Let's go to the third question. It's already on your screen, audience. PCOS symptoms can include excessive hair growth. I think this is a clear, short answer. We have discussed this a lot, and the audience is telling false still. Okay, true, true. So they're true coming in. Just a few. So his hirsutism is there, which is called excessive hair growth, and it is caused due to the male hormones, and it causes excessive hair growth in areas such as the face, chest, back, and it's usually due to the elevated levels of androgens. And you can tell how dietary management can be done for this.
So I'll be very honest here that it is a result of um, as a of PCOS as a whole. So if you are following a very good lifestyle and your all hormones are balanced, so your testosterone is also balanced, definitely your growth will start reducing. If you are doing any kind of epilation, your growth will start reducing. But if I tell you, you are not doing anything, you have a facial hair growth as a result of PCOS, now you have reversed your PCOS, you have not touched your facial hair, they are not going to disappear. Okay, they are not going to disappear with any herb, whatever you do. Their growth will stop till the time it is reversed. You will not have a new growth, but they are not going to disappear. So, yes, when we reverse PCOS, it helps to retard the growth of the facial hair, but they don't disappear. And herbs like spearmint, it's a sister plant of peppermint family. It helps in balancing your testosterone levels, your androgen levels. So that's how it helps to retard the growth. It also helps to reverse the PCOS. You can have its tea, you can have its powder.
Yeah, I like the spearmint tea a lot.
Yeah.
Irrespective of the effects, it's just calming and soothing.
Correct, correct.
Uh, okay, this question is intentionally there. I've put it because whenever I see PCOS sessions or webinars that are there, why are only women invited to it? So I would like to highlight this point that men should also be involved because at the end it's the whole balance in the family that helps the woman, alleviate this or remove. What are the stress factors or the reasons for cortisol being high, all of those in the family. So it's important for men to support their partners or their daughters or their mothers for understanding and the dietary choices that promote hormonal balance.
Correct. And I would also talk in terms of energies. See, when a female has a PCOS, it has a imbalance not only in the hormones but also in her masculine and feminine energies. So I would say that if a strong, healthy masculine energy is involved in the process of her healing, she heals faster. So definitely, men should be involved. Men of complete family, like if she's unmarried, then a father should be involved in her journey, and if she's married, husband should be involved in her journey.
That's great, and the audience are also telling false, so that's good to hear. So the next question is: all women with PCOS have irregular menstrual cycles. We have discussed this clearly. I think let's move on
Yeah.
to the next question. This is an MCQ question. You can just put in the alphabet. So, what is the most common symptom of PCOS? Irregular periods, heightened energy levels, consistent weight loss, or none of the above? Let's wait for the audience. A. So audience are putting in A. Okay, one more A. That's true because all the other options are out of it's just a easy question. And let's go to the next question with that. Which hormone is often elevated in women with PCOS? We have discussed this right at the beginning. Let's see. This is a little difficult for the audience who have not known about hormones as such. But would you like to add on the hormones and explain how, the hormones play a role?
So, estrogen plays a very important role from day 1 to day 14 of our cycle. And progesterone is also called a pregnancy hormone. It plays a very important role from day 15 to next day 1 of the cycle. Testosterone, we have already discussed, it's an androgen, it's a male hormone, and cortisol is a stress hormone. So, if I talk about specifically PCOS, so when we talk about, see, all these hormones are out of balance. But when we talk about the hormone which is mainly out of balance is testosterone. That is why there is a increase in the belly fat. That is the reason there are irregular cycles. That is the reason there are hormonal acne. That is the reason there is a hirsutism. So testosterone is responsible for most of them. But as I discussed in the start, the key hormone which starts everything are only two. So insulin and cortisol.
Yes.
So here
Uh,
C is the right choice over here,
yes.
but I was just going to the beginning, the origin of the PCOS.
Yeah, the audience has a lot of mixed responses. They have given C and B as
Yeah,
well
it's
as
confusing. It's
answers.
confusing. We cannot
Yeah,
hold one hormone responsible for PCOS. Almost
yeah.
all the hormones are involved.
I think all of the answers would be considered correct in this case. Okay, the third question is which of the following lifestyle changes can help manage PCOS? Regular diet, high sugar diet, stress management, or both A and C?
This is easy.
Yeah, A and C. Yeah, the audience says A and C.
I would say
That's
that
true.
A and C are the lifestyle changes that can help manage not only PCOS, but almost all the conditions of the body.
Yeah, I think I would like to add sleep into that because sleep,
Yeah.
stress,
Stress
and
sleep is
diet.
one of the sleep is one of the main component of stress management.
Yeah. Okay. The second last question for today. PCOS can increase the risk of which of the following health issues? Type 2 diabetes, heart disease, endometrial cancer, or all of the above? Audience say D already. So it's very clear because how the insulin works, and insulin works throughout your body. So at the end, it causes a lot of issues with all your cells, and those cause diabetes as well as heart disease, and the endometrial cancer also comes along with it.
True.
And when we talk about underlying condition that affects all of these, it's important to have a well-balanced diet that promotes hormonal balance. And once those are in balance, I think all of these problems also take, backstage.
Absolutely.
So last question, what is the primary treatment for managing PCOS symptoms? Surgery, lifestyle changes, hormonal medication, or both? So there was a thing that I heard about. There was earlier when they would treat PCOS patients, they would, uh, puncture the ovaries in order to cure the disease, which is not the case now. Earlier, they did because they thought that would help, but over the time, the doctors started, puncturing the ovaries more, and that caused more issues with ovulation. There was no ovulation, so they've stopped that. So definitely the answer is not surgery, but lifestyle changes as well as hormonal medication in severe cases is are the answers. So both B and C is the
Both
correct
ways.
answer.
Yeah, yeah. Primary treatment is lifestyle changes, but when there is no other resort left, so the disease is
Mhm.
very advanced. If a patient is bleeding for more than a month and we have to somehow stop the bleeding, then hormonal medications are prescribed.
Yeah. So I think with that, let's end the game and get into the core discussion of today's topic, which is about the social setting as well as PCOS and how it can be managed. So, can we truly have a social life without making our PCOS worse? But before, I would like to arrange the questions in such a way that we talk about before a social gathering, what happens during the social gathering, and what happens after, as well
Mhm.
as when it comes to mind and how that gets affected. So, how can women with PCOS prepare mentally for an upcoming social event?
So we have to understand that what are their fears while attending any social event. So when we are talking about PCOS, there are n number of things. But even people with having the body issues, they will also follow the same things that we are discussing today. So it's all about self acceptance. Usually we are fearful in attending the event because we feel that somebody will comment on our looks, somebody is going to ask us why I have gained weight, why are there hair on my face. So all these things, why there are so many acne. So now when I talk about okay, here we can still do the epilation and go in the party, but when we talk about acne, we cannot do anything if it happens last moment. We cannot do anything about the weight last moment, right? So now first preparing yourself emotionally. First thing is acceptance, because first you have to accept that this is something where you are not at fault. Okay, when you are not at fault, this is something which is out of our control, right? We cannot do anything last moment to just lose fat, or no fat diets are helpful over here. So first is self acceptance. Second is managing your anxiety. See, usually what happen is, if I talk about going to a social event, or being in a crowd, why that phobia happens, because we feel that we are going to look lesser than any other, so that feeling of not good enough. So first of all, you have to work on the core emotion, which is anxiety. So to manage anxiety, the important thing is to regulate your nervous system. So now this is a very underrated thing. See, we have two kind of nervous system. Sympathetic nervous system, if suppose suddenly you face a tiger, what all is going to happen to you? Your heartbeat will be raised, you will start sweating, you will have cramps in your stomach. So these all happen in anxiety. Some of the symptoms are there, some of the symptoms are not there in everybody. But what happens when you are relaxed and you are going to sleep? You feel very relaxed. So that's when your parasympathetic nervous system is activated. Now, here, what all we have to do is to calm down our anxiety, to calm down our sympathetic nervous system. We just have to activate our parasympathetic nervous system. Breath work, breathing is going to do that. What kind of breathing? I recommend longer exhale. So 4, 7, 8. So you will inhale for the count of 4, hold for the count of 7, exhale for the count of 8. 5 to 6 rounds of this immediately helps you manage your anxiety before going to the party. We will also discuss how to manage it if suppose you start getting anxious in the party or in a social gathering. But before going, it's very important. It only takes 3 to 4 minutes if you do it, the right way. 4, 7, 8 breathing. So now, once you have managed your anxiety, you can also do another. I will tell you another technique. So if you like, managing the anxiety is just activating our parasympathetic nervous system, that is a nerve which is vagus nerve. You can just massage your pinna. When you will massage your upper lobe, middle lobe, and lower lobe, your parasympathetic nervous system will get activated. You will do this few times. You can even do it when you are in the public or you are going to perform somewhere. You have to give presentation. You are getting anxious. You can do this, and your nervous system will calm down. So the first step is managing the anxiety after self acceptance, managing the anxiety. Second is, now once the anxiety is managed, then you can actually do some inner conversations with yourself, right? Which are also called affirmations, which is going to help you that okay, I am whole, I am complete, regardless of the acne on my face, regardless of this weight. This none of them defines me. Okay, none of them defines me. I am who I am. I am whole. I am complete. I am strong. Any affirmation, any positive inner conversation that resonates with you is for you. Create your own. That's absolutely okay. Sometimes when I say I am whole and I am complete, it might not resonate with me because there might be underlying belief that no, I'm not complete or I'm not perfect. I choose to believe I am whole. I choose to believe I am complete. So here you are not even feeling that I'm lying to myself, but you are choosing, because see, happiness is a choice. Okay. So if you want to feel good, feeling good is a choice. I choose to feel good in the moment. I choose to feel confident. So once you feel that you have done enough inner conversation and you are feeling even better, then you can just close your eyes and you can just plan. You can just plan like how the you want the party should go, how you want that, how that gathering should go. If you it's a professional gathering or a personal gathering, so okay, I'm entering, I am very confident. See yourself with your neck up. So I am very confident, and you are talking to people, you are smiling, and at the end of the your get together, you are feeling very content. You can see that, you can choose to see that in your mind before it happens in the reality. Regardless of what is going to happen, we can anytime choose that what we want. Okay, so that is something that can be done. And something practical that can help you, maybe you have somebody close to you who is also attending the party. Just talking to them and taking some information and feeling confident, okay, somebody is there. Though this is a kind of external validation, but we are humans and sometimes we all need that, that okay, somebody is there to be with me, even I don't have to stay alone over there. So this is how emotionally you prepare yourself. When I talk about physically, if you are going out, so you have to ensure that you are properly hydrated. Okay, you should always keep having fluids. So hydration does not only mean water, it can be glucose if your sugar levels remain low, or if you feel that no, you cannot have glucose, it can be ors, or it can be any fruit juice or any water rich fruit as well. Okay, so keep yourself hydrated. It can be simple fresh lime or herbal tea as well. In terms of food, always try to have something that is going to keep you full. Understand, are all hormones, they are basically protein in nature. Okay, so if you will have protein before going in the get together, there will be two benefits. You will feel fuller for a longer period of time. You will not end up binge eating over there. And second thing is, it is going to keep your hormones in balance. So there will not be any kind of anxiety or mood swings, because when our hormones are balanced, usually we are balanced. Okay. So whole grains, maybe legumes, boiled chana salad, boiled moong salad. So all these things you can consume, or maybe sorted paneer, and like it's your choice. If you eat non-veg, then egg whites. So all these things will help you prepare before going to the get together.
So to summarize this, first we begin with accepting who we are, calming down our anxiety. Then there are techniques in which you massage your pinna, and that's the way to calm yourself physically, as well as positive self affirmations, as well as positive affirmations you can get from your gang or your friends, your family. And along with that, nutrition interventions that come in with good food, herbal teas, hydration, as well as even I think a lot of herbs can help with that since they are antioxidant rich. So giving that soothing, calming effect, that's the first thing that happens. So with this, what let's move on to the second part of the social gathering when you're already present there, and that's when you're hit with an episode. Oh my God, he's looking at my hair, or she's looking at my body weight, or what's the situation? What's the solution then?
Okay. So yeah, we're here. Most important thing is disconnecting from your mind. And what is going to disconnect you from the mind? Connecting with your body. How will you connect with your body when you are getting anxious in the party? Somebody is looking at you. Just change the taste of your mouth. I would always advise to carry some chewing gum, mint paste, or soft fennel seeds, right, to with you, so that, or maybe cardamom, which can immediately change the taste of your mouth. This is going to connect you with your body and disconnect you with the mind. Okay. Once this happens, then how to calm down all the storms that going on inside? Change the temperature of your body. Drink a chilled water. Okay, that is going to help you manage your anxiety. Once you feel that, okay, I am 10% better, 20% better, because now you are disconnected from your thoughts. Now they are not coming, what he's thinking, what she's thinking, because you are focusing on your body. Feel your feet on the ground. That is again connecting to your body. This is the third step. So you are feeling the ground, you are being more mindful. Okay, so when you are feeling your feet on the ground, you become centered, you become grounded. So when you are in the body, understand one thing, that why these diseases happen, because we have two children. One is our mind, one is our body. Most of the time we are thinking we are in our mind, and our other child feels very much ignored. So whenever you will give attention to your that child, you will suddenly start feeling better. So when you feel better, you look better. Because see, there we have you must have seen people who are not very good looking, but they are magnetic just because of their confidence. So you have to understand, looks are only going to matter for you or for a materialistic person, but it is not going to matter if you have that kind of personality and confidence that is going to own the room wherever you enter. And that is your goal. Your goal is not to get rid of the acne. Your goal is to accept yourself with those flaws. It's okay, we are working on it, but you have to detach yourself from the outcome when they are going to disappear. No, that's, I still get my hair growth on my face. I still follow the methods of epilation, and that's okay because I have accepted it. It's absolutely fine. So acceptance is always the first thing. So again, coming back to the point, that when you are anxious in the social gathering, you have to first disconnect from your mind by focusing on your body. So once it is done, go to somebody you find comfort with, start talking with that person with the confidence. You have to normalize this before expecting anybody else to normalize. Ayurveda says, Yat Pinde Tat Brahmande. Whatever is inside reflects outside. The universe is consists of same components as our body. So if you don't have acceptance inside, you cannot expect acceptance from other people outside. First start I'll share a very small incident with you of my personal life. Once one of my friends, she met me and she just said, oh, you have gained so much of weight. So, and when I gain weight, yes, it's a talk of the gathering, because they know that I am very conscious, but we all are humans, like, right? So I said, okay, what is weight for? You can gain it and then you can work on losing it. You can gain it, you can work on losing it. She said, and after that, it was my dinner time. I sat down and I was having my favorite soul food, which is paratha. And she said, I just said you have gained weight and you are still having your paratha full of ghee. I said, it doesn't matter to me because you are feeling I have gained weight. For me, it's nothing. It's very easy to lose weight. That is one affirmation I always tell myself when I gain. It's a temporary phase. My body knows how to lose. She said, if I would be at your place, I would not sleep whole night if somebody comments. So it's a choice, guys. You can actually you cannot control the action of anybody else, but you can choose your response, your reaction. So I would say that, go to people, talk to them very confidently, accept yourself, and you will see that wherever you will go, the talk of the town will not be your PCOS, your acne, your gain weight, but will be your confidence.
Along with the physical and the emotional things, I think dressing up also with what, confidence, what you are feeling comfortable in, along with actually keeping a healthy, balanced meal throughout your life. Because it's not like one day you have some green leafy veggie or you have a green smoothie and tomorrow you'll have amazing skin. It has to be there consistently in your
Consistency.
food, in your and in your lifestyle, and that's when that hydration should be there, which will be shown in your skin and overall health. Along with that, you pointed out how giving shock to your body in a way, like having a chilled drink, or grounding, feeling your foot of feeling grounded, as well as how to change the taste in your tongue. I think it comes boils down to having some sense, like activating your senses, like your taste buds or your
Mindfulness. This is mindfulness.
yeah, yeah.
Staying
So
in the present. So yes, as you said, wearing comfortable clothes and which actually you can carry very well. You don't have to follow the trend. Set your own trend. If you feel that people look good in body hugging clothes, but I don't, it's okay. If I look good in flowy clothes, I am going to wear flowy clothes. That is what I am comfortable with. I am not in race with somebody. These can be your some of the affirmations that you can note down. I am not competitive. I'm not in race with everybody. I want to become better version of myself, not another version of them. Okay, so these are the things that are very important. So wear clothes that look good on you, that suit you, and that actually gives you that kind of confidence. Because confidence, the one aspect of confidence is how you what you wear as well. She is absolutely right in saying this, that comfort is the key. So see your comfort rather than seeing what everybody else is wearing.
yeah, and let's combine the last part of this uh, podcast, wherein what you would do after the social gathering, as well as what would be in your mind after the social gathering. So we have talked a lot about mindfulness and what has to be done when you are there, present in the moment, and you have been hit with a panic attack or an anxiety attack. But what happens when after the social gathering, and what would be some Ayurvedic remedy to, some herbs that you can let the audience know about?
So I always recommend lemon ginger tea with cinnamon and a pinch of turmeric, because it helps your liver to digest whatever you have eaten. In the social gathering, focus on small portions. You can eat everything, but small portions, so that your liver does not have to work on the detoxification. It work very hard for the detoxification. It is a process. So when you come back, you can have lemon ginger tea with a pinch of cinnamon powder, with a pinch of turmeric. You can have chamomile tea, or maybe tulsi leaves tea, to calm yourself down, because they reduce cortisol levels. They are very good for cortisol levels. And these are the herbs. You can have ashwagandha leaf powder, when if you are trying to have something extra, some extra supplement. Ashwagandha leaf is a very good de-stressor, so you can have these. When coming to okay, now coming to post gathering diet. For example, you went there and you had a lot, and now you, rather than regretting that okay, I did binge eating, focus on compensating what you have eaten there. Try to help your liver to detox what you have eaten there. So I have already told you herbal teas, but always keep your post 2 or 3 meals very easily digestible. That doesn't mean that you have to starve. That is going to not help liver in any way. You have to choose, maybe moong dal khichdi, dalia, upma, all these things which are very easily digestible. Your liver does not have to work a lot to digest those things. Okay, and add lot of vegetables, so that you can add fibers and you can stay full for a longer period of time. So you can actually make your next 2 to 3 meals suitable as per your body digestion. And if I talk about emotionally, how you handle if something happened there that you are not able to get rid of from in your mind, you have to constantly remind yourself that one event or one incident does not define my worth. Okay, then this is not, you will not let it be a trauma for your whole life, because the life is a larger picture. So yes, these are the things, and ensure that after a gathering you have a proper rest, because you need more sleep when you are in the energy of so many people around you. Because when we are in a social gathering where there are so many people, I will give you an example. See, you take a walk in a garden in nature, and you take a walk in the mall full of people. When you will return from your morning walk in a garden, you will feel energetic. But when you will return after walking same amount in the from the mall, you will feel tired, because so many energies are there, disturbed energies, happy energies, sad energies. So we actually pick up people energy. So it is very important to rest and rejuvenate our minds as well after coming back from a social gathering.
So I think I'll again conclude the last part of it. When it comes to dietary intervention, herbal teas, as well as good quality food that is light on your body, easy to digest, as well as proper hydration. Along with that, when it comes to mentally, you have to accept yourself at the end of the day, and remember that it's not a one-time event. It's a one-time event, and that doesn't make a difference to anything of your life. And at the end, you need to take good rest, good sleep. And we have a question from the audience that says, is screening recommended for PCOS before marriage? Or if irregular periods are there, wait for marriage and give sufficient time, that is few years, because it is escalated due to stress after marriage.
See, I would not recommend screening just because you are getting married. But yes, if you have symptoms, you can get your tests done. Usually, symptoms are the major screening in PCOS. So, if you have cyst in ovaries, every woman develops cyst in their ovaries just before the periods. So, just having cyst is not a sign that you have PCOS. Sometimes periods can be delayed without PCOS as well. Even if you have cyst in your ovaries, but you don't have other symptoms, but just the period gets delayed once, it can be because of the stress, it can be because of the travel, it can be because of the change in food or weather. So that does not, you don't have to go for screening. How I diagnose PCOS is with a set of symptoms. When, yes, there are acne coming up, there is a hair fall, you are not able to sleep. So again, the first key symptom, most common symptom we learned today is the irregular cycles. But the first symptom is irregular sleep patterns. You are not falling asleep till late at night, but when you get up, you don't feel energetic. So that's the key symptom where you have to focus. So when you have these symptoms, the screening is already done. And even when we talk about the treatment, holistic treatment, what will a sonography do? After that, we are not going to do anything about it. So when symptoms are to be treated, then we have to understand that we just follow the holistic things. We don't take over stress of, get a yeah, sonography is done when we say that, bleeding is not stopping, and then you are losing weight day by day, and there are things that are happening that make us doubt that something is affecting your liver. Then doctors will prescribe you. There is no need for just precautionary screening before the marriage. And yes, you said right that after the marriage, our whole lifestyle changes, our life changes, and temporarily there can be changes in the menstrual cycles as well. You have to give time. I would give you a very powerful tip. So maybe somebody in your family is getting married and you don't want them to go through all these things in their menstrual irregularities, or maybe you are going somewhere, you are traveling, or maybe for not any reason, just to stay healthy and to keep your cycles healthy. Start having flax seeds in the estrogen dominant period, that is from day 1 to day 14, and start having sesame seeds in your progesterone dominant period from day 15 to next day of your cycle. When you will do these 14 alternate progesterone and estrogen cycles, flax seeds and sesame seed cycles, slowly and steadily your hormones will learn to stay in balance for those 14 days. And within 6 months, you will see, even if your cycles were not regular, they were 10 days delayed, they were coming regular but they were not uniform, they will start coming following this rhythm, 14 days, 28 days cycle. So that is one thing that can be suggested. Whenever I have any kind of unmarried patient who is going to get married, okay, she's taking a treatment of something else, but if she's going to get married, I always advise her, start seed cycling before, 2 to 3 months before your marriage, so that after your marriage your lifestyle should not affect, because seeds, they mimic those hormones, so they are going to keep those hormones balanced in your body.
Yeah. I think it was a great session. If there are any more questions, we have already exceeded the time, but we can take up one or two questions. But it was great having you here. There was a lot of things even I learned, and I'm sure the audience also learned a lot of things. And thank you so much. It was a great session. Um, I think let's close, and the audience are also telling thank you for the very well elaborated answer.
Thank you,
Everyone
Khadija.
loved it.
Yeah,
Yeah.
and thank you so much, Khadija, for inviting me as a guest. It's my honor to be here. And thank you, audience, for being so interactive and for staying till the last of session.
Yeah. I think let's close, let's end the stream. Thank you
Yeah,
so much.
thank you.